Well, when we started off, we had one little suburban ambulance, if you want to put it that way, and you had to call the doctor and route to the hospital for him to meet you there. That's how much it's changed.
We've known that the industry has known for several years, or they've focused for several years on the fact that we do need to do something to better protect our own. And while we've known it's there, we focused on the idea. We haven't seen much changes in the industry towards that. So whether this is the type of ambulance we would buy next time or not, it excites me to see that there's some movement in the industry.
Safety of the crew and the patient is really high on our list. So any innovations, any changes in the industry that assist with that, make us safer, make our patients safer, make the people around us safer, we're really for it.
We spend a lot of time talking to our students about how to stay safe doing our job, and how you set things up in the back of the truck and then being restrained, like you say, that's pretty important. So we try to make sure they're very aware of that.
I think it's got a lot of functional use for the patient and the crews. I think that they can really get to and access the patient a lot easier, and the room is really, really incredible to see the way they've recessed it, where somebody in my height can almost stand up and not hit my head on everything, as well as the crews appear to be very, very comfortable with the patient loading.
The truck's a real nice truck. I can see a few changes. Like I said, with the transporting of the second patient, that's set up to transport one patient. Now, the way it's set up right now, I think it would make a real fine critical care transport truck, where you can have access from both sides of the patient. And you got enough room in there to where you can really take care of your patient. With a few design changes, I think it'd make a real fine truck.
It rode real smooth, man. Compared to all the other ambulances I've rode in, I really like the side load compartment. Just the amount of space you have between you and the patient. You don't feel crowded, but however you can give adequate patient care with the distance the seats are. I do like the swivels. You're not stationary to one position, and cabinet space is awesome. It's all around good truck, man. It looks good. It's probably the best thing I've seen out there so far.
I think a big thing for me is just the fact that you can stand completely up, and I'm about 6 foot, and I was able to stand up there no problem. My head wasn't touching the top at all. I'm not slouched over.
It rides really smooth. It's a lot of room back there to work. I especially like the captain's chair that slides back and forth and pivots.
That's what we focus on, reducing the potentials for our crews to be injured, reducing the potentials for our patients to be injured. That's our primary focus, especially when we're looking at ambulance and equipment design.
And it would also work good for an MCI. Just get rid of the cot and put like a table or something like that in there.
Or like a fire rescue EMS company, it'd be an ideal truck, I would say.
By actually being a patient and laying down in it, it gives you great immobilization, and you can also get C-spine immobilization, be able to strap the patient down, and actually it's very comfortable, and I think would decrease the amount of skin irritation from being on a longboard for a long amount of time.
I like it a whole lot. It's really lightweight. The seal that you get while you're inside, it's a better seal than I've had on any spine board.
I'm really familiar with the equipment that y'all brought. I've been dealing with Hartwell Medical and Inferno for over 20 years now, and they make fine equipment.
I took a look at the stair chair. I've never used one. I like the idea of having one as far as getting downstairs and whatnot, and being able to manipulate tight corners with the stair chair. I like the idea of that.
The combi carry is a real good device. It works a whole lot better than the scoop stretcher, whereas you don't have to take it apart. You just open it up, slide it under your patient, and I wouldn't say that it's better than the scoop. It just seems like it's more easier to operate than the scoop.